Good afternoon, everybody. Thank you so much for joining us for our September Family Advisory Council meeting. I see a few folks who are joining us and trickling in. I really appreciate your time and spending with us. So today we'll be having our updates. We have ASL interpreters, and we also have C-print captioning. So if you need that, please feel free to use those options. So with Zoom, we want to encourage everybody to remain muted when you're not speaking. Use the video features. And if you have a particular concern about services, we will be happy to connect with you. So this time is to be used to share updates from our leadership, as well as receive any questions about some of our updates. If you have any particular concerns, please reach out to us. So this morning, we're going to start with community life engagement updates. We'll be getting an update on the budget, which recently passed, Medicaid and waiver updates, updates regarding the Ohio ISP, family updates, and we'll have some time to speak with our DODD leadership. Okay, so I'm going to turn it over to Keith.
Thanks, Meredith. I appreciate it. I'm Keith Banner. I'm with the Ohio Department of Developmental Disabilities, and I'm the statewide lead for community life engagement, which includes the Tech First, Technology First initiative, the Employment First initiative, and anything related to adult day and employment and transition of adults from school to life. So basically anything that has anything to do with community life, we're going to try to help out with. So move on to the next slide if you don't mind, Meredith, or can I do it, or no, you're going to do it for me? Okay, cool. I wanted to start with the an update about the partnership we have with OOD called Works for Me. It's a 5-year federal grant that OOD received, Opportunities for Ohioans with Disabilities, which is the vocational rehabilitation agency in the state, to help people who are currently receiving sub-minimum wage to move to competitive community employment. It's been, and this is going to be the first year that it's been in existence, and we're getting to that first year anniversary in October. We have a project manager on my team named Melissa Morelli, who's kind of leading the way in there, working in the Northeast first to kind of figure out the best way to support providers, families, and the people themselves to kind of think about and reimagine what it looks like to, slides went away, Meredith. Thank you, sorry, to think about getting a job in the community. So I'm ready to move on when you are. Thank you. Wanted to mention the Team Maps project that we have in association with Ocali. We have quite a few regional map teams, which are multi-agency planning teams that support schools, DODD, county boards, families, students, and everybody else involved in supporting folks who are transitioning from school to adult life. And these teams kind of talk about planning beyond the specific plans that each organization needs to have to kind of work toward what is an actual plan for transition that would support the person to have the life he or she wants once they move from school to adult life. And those are ongoing projects that I think we're going to have some stories about them coming up in October. So I'll keep you posted. Ready to move forward. We also have a grant that's grant work that's ongoing with collaboration with the Ohio Department of Education to support students and adults who are looking for a different pathway to a career as opposed to just a job. And so this would include credentials, apprenticeships, partnering with post-secondary partners to kind of support people with developmental disabilities to kind of revamp and kind of look at the different ways to have a career, not just a job. And those four organizations, Auburn, Ohio State University, University of Cincinnati, and Youngstown State, are all working on it. We have a meeting actually today at 2 o'clock, so I'll have more information after that, but they've been working really hard to kind of build the program and kind of scale it up to support people with developmental disabilities to access post-secondary opportunities they haven't before. Ready for the next one. We also have an adult day support pilot project that we're getting ready to stand up here soon. That's going to support 76 adult day support providers to invest in being more have more technology and more efficiency, and then also to develop a quality measure set and support them through funding to pay for quality management and staff training time. So you'll be hearing more about that coming up in the upcoming weeks, but this is kind of a really great opportunity to support and invest in adult day support providers, and also look at quality measures that they could kind of work towards so that we could pay them for quality measures, like supporting people that have more significant needs, supporting people, supporting them to support folks to have training on daily living skills and kind of discovering what their interests are. All those quality measure sets are being stood up through this project, and hopefully by the end of it, in a year and a half, we'll have information and a new way to kind of talk about and support adult day support providers. We also were blessed with some funding from the governor's office for fiscal year 24-25 around technology first. I won't read all that to you, but it's $3.2 million per fiscal year. And the next slide is going to show you some of the projects that we're going to request proposals for. Innovative Technology Solutions is already out. The RFP is already out, and it's circulating, hopefully, and we're going to get some great proposals and responses. That's basically a project where vendors, companies, providers can kind of think about some kind of technology that doesn't exist or that does exist, and new ways to use it and solve some of the problems that folks have, and organizations have. We also just stood up this week regional technology hubs, an RFP around, in many areas of the state, there are triad apartments where people can go to and try out different kind of versions of assistive technology, and there are lending libraries in different areas. We wanted to call out to those already existing kind of technology hubs, would you like to go to the next level? Or in regions where there aren't technology hubs, places to experience and talk about and learn about technology, maybe those organizations that are in those regions would like to start a regional tech hub. So that just came out on Monday, so we're looking forward to that one. We're also going to look at supporting ICFs and figure out how we can support them through supportive technology with the funding. We are also looking at supporting HCBS waiver providers residential providers who might be interested in adding remote supports to their portfolio of services they provide. And again, building residential tech capacity, supporting residential providers to kind of look into how tech might improve their supports and services. We have two technology communities of practice that happen bi-monthly, one bi-monthly and one quarterly, one specific to technology first, one is specific to assistive technology. Vendors, providers, county board folks, families, people being supported are all invited to kind of be a part of the conversation. And you can email me or Britta, my cohort, at those emails, and we can get you involved in that if you're interested. And we also have an assistive internet assistance project for fiscal year 24 and 25, where if folks who are being supported by county boards don't have the funding to pay for broadband Wi-Fi access, county boards can be reimbursed for that payment. And you can get all that information. I think the slides go out to you guys with the link there, but I wanted to mention that. And we have a monthly Tech First update that comes out. Actually, it's coming out this week, I think, the September one. You can go on that link when you get the slides and subscribe to that. And every month, all the stories that are happening around what the grant outcomes, what's happening with different tech vendors, what's happening with the Ohio Technology First Task Force, just every variety of tech and how it relates to people with developmental disabilities in Ohio will be in that newsletter. And that's me. I tried to go as fast as I could. I didn't want to take too much time, but if you have any questions, you can reach out to me anytime and we can have a discussion, conversation, anything you want around community life engagement. Thank you.
Thank you so much. I did see a few questions in the chat. If you have some time to answer a few.
Yeah, sure.
So, would these quality measures play out similar to the STARS for early childhood and daycare programs?
I'm not too familiar with that, so I'll just explain the way that we're looking at the quality measure set on our side and see if maybe, Lynn, that connects to what you're saying. Basically, what we want to get to eventually is to be able to incentivize quality through payment for quality. So as we kind of have a conversation and discussion with the field around what are quality measure sets, that's what we're looking for, is what do we want to pay for to increase the likelihood that it will benefit people more. So those quality measure sets are kind of, we're building that baseline now with this pilot. So that's the initial kind of figuring out of really what is quality, what kind of measures can we kind of attach to adult day support, and then what way can we pay for that to increase the likelihood that there'll be more quality coming out of the adult day support world. I hope that made sense, and that may be attached to that what you're talking about with the STARS.
Yeah, and just from the standpoint of like a daycare center that implements a lot of quality measures and services and things, they earn more stars and they then advertise that, you know, we're a 2-star center, we're a 3-star center. It's maybe not, adult day programs are probably not needing to advertise in order to bring in more business. If anything, they've got wait lists and they're turning people away. So it may not be an incentive for them to give them a way to brag about what quality measures they've met. But it was just a thought that it might be something that would allow families and consumers to compare and say, wow, you know.
Yeah, that makes sense. And I think one areas that would link to is we're trying to figure out and support providers of adult day supports who maybe are interested in supporting people who sometimes can't access the service due to the level of their need. So that's one of the quality measure sets, is trying to figure that out. And that would be a good way to communicate with county boards and families, possibly eventually when we get to the point where we have the baseline and we're looking at paying for that outcome. That would be a way for them to explain, we're interested in trying to figure out with you and your family and the county board how we can support somebody in this service. So it kind of could be a part of their communication, right?
Yeah.
And then, thank you. Lynn had another question. Would folks who access the internet project this year have to reapply for it next year?
The way it's set up is that county boards would be connect to them, and the county boards have to become, they had to do a master, I forget what the name, Stacy, you can come in on this one if you want to. Are you on? Yeah.
I am on. Hi.
Yeah.
Hi, everyone.
But the county boards would have to reapply, but the people themselves, they would go from a span to span kind of situation, right?
Yeah, so Lynn and others on the call with the Internet Assistance Project, we have it set up as a direct reimbursement to county boards. And so county boards, if we have around 47 who have signed up to participate with us, if they've signed up, they've basically agreed that they will cover the internet for a person, and then they invoice us and we repay them. What the internet is covering is if they need a remote support service, an assistive technology service, Station MD, or other telehealth or virtual services, that's what we will reimburse the county for. So reach out to your county board if they're participating, and then it is actually set up with them by fiscal year is how we've set it up. So We're currently right now, starting in July, we're in fiscal year 24 and the funds go for 2 years. So if you apply right now, it'll last for 2 years if the county board does an application. If you've done it before, kind of current fiscal year, it was an application by year, and we aren't doing that anymore. We're able to do it by the actual budget biennium. So I know that's a lot of details, but we're happy to reach out to me directly if you want to know if your county board is participating or not. But we do have that available, and I'll put my email in the chat.
Thank
Great
you.
question, Lynn.
Thank you. And then another question is, could quality measures also apply to HPC providers?
We're so early into the conversation with adult day support and quality measure sets that I don't want to venture a guess on that, but I'm hoping, and I think we're all hoping on our side, is that we'll discover through this pilot project what this looks like and entails, this idea of paying for quality, and that might go into other services, but I don't want to venture a guess on that one. But I think that this is the beginning of a conversation that we can start having around adult day support for sure.
Thank you so much, Keith. Thank you for your time and your updates.
Thank you.
Okay, so next up we have Jeremiah Wagner, who will be sharing some updates about the recent budget. Did he drop off?
No, he's here.
Okay, thank you.
I think he's having some mic issues, maybe.
Yeah, Jeremiah, I can see you, but it looks like you're unmuted, but I
about
cannot
now?
hear you. Oh yeah, there you are.
Okay, I'm sorry about that. I was on the wrong mic. I'm sorry. So I'm going to run through this quickly and just share an update on the budget that was passed in July. Provide an quick overview of the DeWine Husted budget, and then just really dive into some of the DoDD priorities that are in the budget. So on the next slide, just want to mostly start off with a thank you to everyone. This budget was really nothing short of remarkable. It was really built on a lot of the challenges and stories that you shared with us, and that families, people served, and other advocates shared with us over the past couple of years, really particularly around the workforce crisis. And so that was really the impetus for the budget, was the DSP workforce issue of recruiting and retaining DSPs. And so we really built the budget off of that, and it really was historic. So thank you. And if you connected with your legislators or participated in a group like this or came in to testify, thank you. And if you haven't done so, I would definitely recommend reaching out to your legislator and thanking them for their support in the budget. And so on this slide is just a couple quotes, one from the governor and the lieutenant governor, that I'll just read quickly for everyone. From the governor, this budget is one that makes historic investments in Ohio and builds on Ohio's momentum. We're building on our efforts to make sure Ohio continues to be the heart of it all, the best place to live, work, raise a family, and start a business. And then from the lieutenant governor, if you provide people the chance to access an education and earn job skills, you have good jobs available for them, and you stay focused on making sure that you continue to innovate the state for the future, you are giving people the ability to live their version of the American dream. I truly believe if we get the economy, workforce, and innovation right, Ohio will be the best in the Midwest. So you're probably seeing from the branding on this PowerPoint and Keith's PowerPoint, and then the budget branding, the governor and lieutenant governor really casting a vision that this is Ohio's time, and then in a lot of ways, Ohio is the heart of it all for many things. And so the budget really focused on that, and then on the next slide on really three pillars to achieve that. The first being people and workforce, the second being children and families, and then lastly, communities. And so on the next slide, I'll start going through each of those 3 priority areas. But starting off really holistically, again, back to the ask really being really a laser focus on DSPs, and knowing the biggest way that we can affect them, and the most obvious to everyone, is to increase wages. And so if you remember back to 4 years ago, Governor DeWine took office, the average DSP wage and reimbursement rate was around $11 per hour. In that first budget, the governor introduced, and then the legislator built on it, we got above $13. And so that was about $300 million in new funds just to get from $11 to $13. And that was the largest that we had ever seen in our system's history. This budget takes it to a different level, a different realm, a different universe, probably a lot of different analogies on how massive this was. We nearly quadrupled that investment and received $1.5 billion in this budget in new money. And I really attribute that to, again, back to the stories that everybody shared with us and really all stakeholders being unified, and this is the priority, this is what we need to address, and that really came to fruition in the results with that $1.5 billion investment. So again, thank you to the governor for introducing something like that, to all the advocates that came in to testify on it, to county boards for contributing funds to that, and to the Ohio legislator for supporting it. And so I'll quickly go through the 3 priority areas. First, workforce and healthy people. So on the next slide, for us, that really is the DSP workforce. Director Houck in her testimony shared with legislators to recognize the value and work of DSPs is to recognize the value, the people they support. And so that really was our vision and what we looked for in the budget, in the chart. And then on our website, you'll be able to see all the rates that received increases. They really were all focused on getting to a similar dollar amount and a similar percent increase. And so you'll see that. Additionally, ICFs received a similar increase, and then we also targeted ICFs that receive a add-on for people that they serve that are dependent on ventilator care. And so all this coalesced, and the 1.5 billion really to get a target of, we started at 11 in the first budget, we got to a little over 13, had a couple small increases since then, so we're close to 14. And then this budget, by the end of the biennium, or in July of next year, the average reimbursement rate will support a wage around $19 an hour. And so very, very significant. On the next slide, technology. So Keith touched on that, so I won't talk about any of the specific projects, but just to say, in the last budget, we introduced language to codify a policy around technology first, and we established an interagency working group on it. And then this budget built on that to provide a dedicated line item. So those projects that Keith talked about before, we didn't have a specific pot of money to pull through. Now we will, and ongoing budgets will be able to ask for those sort of funds. On the next slide, children and families. And so the slide after that, multi-system youth or youth with complex needs. This budget supports $14 million for those youth initiatives, some new funding in there. And our goal and our vision has really remained the same there, which is to keep families together, keep youth in their homes and their communities. So supporting initiatives to do that, and also to increase the capacity of providers to both provide those in-home supports, but also provide residential options. On the next slide, just wanted to touch briefly on a language item that was in and out, and I think that everybody is aware, but there was language that was added at one point in the process that would have stopped DODD and the Department of Medicaid from allowing parents or other legally responsible adults from being paid providers of their minor children. That wasn't a language item that we were supportive of. So we worked with the administration, with legislators to educate, and we're thankful that that was taken out for the final bill. And since we've been working with partners, and hopefully if you're getting Family Connection and Memo Monday, you're seeing updates about that rule. Then lastly, the last pillar is communities. And so for us, that really looked like a few different things. First, advocates had been asking us and others for a requirement that every county board of DD have at least one person on their board who is a person with a developmental disability. And so we were happy to partner with them on champion that. And so the governor's budget introduced language, and we worked with stakeholders throughout the process to kind of improve and get everybody in agreement of what that looks like. And so starting in the next couple of years, it'll be a requirement as there's a vacancy that county boards look at this. And so in the very near future, every county board will have at least one person with a disability on it. So again, really happy about that and excited to partner with advocates on that. And then lastly, in that community realm for us, the first one, something that we really haven't done before, that some county boards and advocate groups have championed, but universal or adult changing tables. And so we requested money through ARPA HCBS to be able to support locals and businesses and installing these in public places. And then additionally, there is language for both DD council and county boards that'll give them virtual meeting options. So we, the administration and the legislator, really saw value in people that might have mobility issues or health concerns to get to some of those meetings. And I think that's something, again, to thank the legislator for. Remote meetings has been a very touchy subject with the Ohio legislature, and not many entities have the ability to do this. And so we're thankful that they made that consideration. And then lastly, just wanted to say I flew through that. So happy to answer questions or jump on a phone call or come out to a group, but also on our DODD website in the slider, or if you go to the About Us, there's a budget page. And on the right hand of the screen, you can see there's a bunch of drop downs. And so there's a ton of additional detail, particularly around the rates and when things are going to get through the rule process. But for all the things that I touched on and more, there's a lot more detail. And so please check that out and subscribe to stuff, and you'll see updates as we release more. So that's it for me. Happy to answer any questions if there are any. Thanks, Meredith.
Thank you. I don't see any questions in the chat, but I'm sure that there will be many more questions coming your way, Jeremiah. So thank you for your time, and thank you for all of the updates.
Thanks, everyone.
So next, we're going to share some updates that are happening in Medicaid. So Nayoka, I think, are you here? Yes.
I'm here, and if everybody can hear me, I think everything's working at the moment. Okay, hi everyone. I'm going to share a few resources with all of you. Some of you may have already seen these, but I wanted to make sure that everyone was aware. We have put out quite a bit of updated information here recently. So we do have all of our draft rules are posted for our Appendix K unwinding. I have shared the links here for everyone. So you will have this information available to you, any of you who have not seen the recent communication. So all of those rules are now out and available for anyone who is interested in reading some of these. And we'll talk a little bit more about some of the specifics here. Also, and Jeremiah just mentioned this piece as well. The rate increases for the approved budget, for the increases for January and July are also available on our web pages. So I've included the links there. So there's lots of information on that page as well for people. The rule appendices are also available on the above link. So we have lots of detail there about the rate increases. The Ohio Department of Medicaid rule that Jeremiah mentioned a little bit ago also, that rule, I believe, the most recent draft of that rule was issued either late last evening or this morning. And there is a webinar tomorrow in the afternoon for that rule. So hopefully you have all received that communication if you're interested in that. And you're welcome to that webinar is not being put on by us, but if you did not receive that communication, you can reach out and we can connect you with that. So there, again, there's lots happening and lots of information available. Some other communications and updates that has come out because of the rate increases, the waivers, the self and level 1 waiver budgets were increased accordingly to cover those rate increases. So this information was circulated a few weeks ago. I just wanted to make sure everyone had that. So effective January 1st, 2024, the self and level 1 waivers will be increased. The child limit will become the 41,424, and the adult limit will become the 62,136. The non-medical transportation and adult day array, those budget limitations will also be increased. We just put the percentages here. Again, those are available now in the rule appendices on our websites because there's many of them. So I didn't want to include those on slides, but there's, for cost of doing business and there's charts. So, and the DDP ranges were also increased by the same percentage as the rate increases. So we were starting to hear from families that they were concerned that they were going to have to reduce their services and there should not be any reduction in services for people. So if anyone has any problems, please reach out to the waiver policy TA. We will work with you. We will call your county if there's any misunderstanding on the county side. So we will be here to help. Next slide. As far as any other rule updates that I wanted to point out, because of the unwinding, we have had to make some changes to the rules with homemaker personal care, the inability to extend that permanently with shared living on the same day. So we've had to make some changes to make that residential respite instead of homemaker personal care. So those are available now, the draft rules. In addition, we also are allowing, in our draft, there's a proposal for allowing exemptions to shared living. So the possibility that someone would not be required to use the shared living service. So those are now available in the draft rule that's posted on our website as well. If anyone has any questions about that, again, please reach out to waiver policy TA or reach out to me directly. We're happy to answer those questions. Two more things I did already mention the stakeholder webinar tomorrow. And if anyone needs that communication, let us know. The other thing that I forgot to put on my slides is that the other addition that we had put into the rules for our permanent Appendix K unwinding is the ability for paid caregivers to be able to be paid when someone's hospitalized for limited periods of time. So we are going to submit that into our waiver amendment for CMS approval. So if CMS approves that, that is in the draft rules for HPC, PDHPC, and shared living. So with CMS approval, that will become permanent for with parameters. So up to 16 hours per day for 30 days per year, a caregiver could be paid while someone's hospitalized to provide care. So that's another item that is in the draft rules that I wanted to point out. Any questions?
Thank you so much, Nayoka.
Of course.
I do see that Lynn Vogel has her hand up.
Okay. Hi, Lynn.
Hi, Nayoka. So I had a parent reach out with a concern about the current draft rule language about Ohio shared living and HPC as respite, right?
Okay.
And I haven't had a chance myself to go in there and read it myself to see if I think that this parent is off base with their interpretation of what they're seeing. But the concern was, as they were reading it, they felt like it was saying that in order for the parent who's doing OSL, Ohio Shared Living,
Mhm.
to get access to that relief through residential billing as opposed to HPC billing, her interpretation was that the respite would have to take place outside of the family's home.
Okay.
Is that a correct interpretation?
So she's wanting to use HPC or she's wanting to use residential respite?
Well, my understanding is the only way a parent billing OSL can get a break is to utilize residential respite now as opposed to
Correct.
HPC.
Right.
But so does that mean that the respite has to occur outside the family's home?
No, that the rule, I believe we've made it pretty clear that residential respite, especially the 15-minute, can happen in a variety of locations.
Okay.
But
That was my understanding. And like I said, I haven't gone back to reread the rule language myself to see if I thought she was misinterpreting, but that was the concern. And so I just thought I would bring it up.
Okay. We had a bit of confusion last week about on days that the shared living provider does not bill and HPC being available on those days, but I think we've cleared that up. So I wonder if that is maybe what confused them.
That could be.
Yeah, but I think we're all cleared up with that.
Okay. And then my other question is, and again, I haven't gone back in on a previous open comment period. We at F2F asked for some clarification, and I haven't gone back in to see if anything's been posted that makes this clarification, but I should have done so. But in the parents of minors getting paid under extraordinary care circumstances, one thing that I read seemed to say that if the parent or, okay, there were two things. One was if the parent cares for other minor children in the home, that would disqualify them. And that didn't seem to make sense to me. And the other one was if the parent or another parent is getting paid, has a paying job, it made it sound to me like if I'm the mother who had to give up my job in order to care for my child, and my husband has a full-time paying job, then I can't be a paid caregiver. And that didn't make sense to me either.
I'm not sure I understand the second question to be what the rule says. So you're saying that if I'm the parent who wants to be the paid caretaker, I can't if I have a working father?
If I have a working spouse, if the other parent is gainfully employed, when I was reading it, it seemed to say that you couldn't be a paid caregiver. It sounded to me like you could only be a paid caregiver for your minor child if you're a single parent, like the only parent of this child caring for them. And if you have no other children that you're providing care to.
Okay. I did not read it that way, Lynn, but I can't say, are you coming to the webinar tomorrow?
Well, I plan to now.
Yeah, I
Now
think
that
you
I know
should.
about it.
I think you should and ask both of these questions.
Okay.
Because I do read your interpretation of the first question is how I read it. The second one, though, I didn't read it that way. So I would be curious if you ask these questions to Ohio Department of Medicaid, if, you know, their interpretation, but they would respond.
Okay.
Yeah.
Thank you.
You're welcome.
Thank you, Lynn, for those questions. I know that we did post the information about the ODM.
Thank you.
webinar
Thank
in
you
the
for that.
chat. Thank you, Corey. So yeah, and I will be sending a follow-up with information and the links that are in the presentation as well. Do we have any other questions for Nyoka regarding Medicaid or any of these changes? Okay. Thank you so much, Nyoka, for your time today, and thank you for answering all of our questions.
Sure. Thanks for having me.
Sure. Okay. Next up, we will be speaking with Stacy Collins, and we'll talk about the Ohio ISP and some updates in that area.
Thanks, Meredith. Hi, everyone. It's great to be here with you this afternoon. For those of you I haven't met before, my name's Stacy Collins, and I am with the Department of Developmental Disabilities in our policy division. And I am here on behalf of Beth Chambers. So usually you have a chance to connect with Beth, who is the statewide manager of the Ohio ISP work and team. So, and she is out today, so I'm happy to be here with you today to provide some updates about Ohio ISP. So just some reminders that I wanted to be able to share with you about the Ohio ISP for those who are familiar with it, and maybe those who are participating today who are new to Ohio ISP. But Ohio ISP is a transition to a new way to assess and plan across Ohio, and it applies to both county boards and ICFs. And so related to county boards, it applies to any individual who is a home and community-based waiver recipient, and any person who lives in an ICF. And so if you're on the call and your loved one, those that you support don't have a waiver or not living in an ICF, the Ohio ISP is not required. So you may or may not experience it. So some county boards are choosing to use the Ohio ISP for people who are not waiver recipients, and just to keep their practices consistent in the way that they're interacting with people and families. But it is only required for HCBS, that home and community-based waiver recipient, and a person residing in an ICF. So with the Ohio ISP, this again applies to an assessment for needs and services, and then leads into planning for those needs and services. And so I wanted to communicate that we have county boards of developmental disabilities and ICFs really working to transition to the Ohio ISP. And what this really involves is it does involve them looking at their policies and their practices, and how they are communicating to people and families, and how they're communicating to their personnel and their teams. And so how you may experience the Ohio ISP may be different because everybody across the state is in a different place. And so I just wanted to kind of share that information. Also, you know, we talk about Ohio ISP and it is assessing and planning. I wanted to make sure just to go over with you that the Ohio ISP has three major components when you're talking and thinking about the Ohio ISP. One, it includes what we call an introduction page. And so it is really kind of a starting page that just really summarizes the person, who they are, what's important to them, what's important for them, and really highlights key information that a team needs to know about a person. It has the option of including a picture. Then it moves into what's called a discovery assessment. And so the assessment, the official term is a discovery assessment, where it asks several different questions about different areas of life. Some questions may apply, some questions may not apply. And so again, there's going to be consistency in kind of what it looks like in the questions you get, but not all questions might apply. And so a county board or ICF might not ask. And then the third part is the actual ISP. And that if I can get my words out, accumulates to kind of one big package of three major components that live within that Ohio ISP. Currently, right now, we are just monitoring and watching how many plans are being worked on in the system, and their plans can be in multiple different spaces and in different ways it gets to us. But we right now have about 12,000, excuse me, plans that have been entered into our system from county boards of developmental disabilities, which is about 27% of our home and community-based waiver recipients across the state. And there are over 1,400 plans that have been submitted in from our intermediate care facilities. And that's about 29% of people residing in ICFs. And so we have a team dedicated here at the department to really help in the transition to Ohio ISP. And I'm going to really emphasize it's that transition to these new conversations and new ways of talking and planning. Beth's team is leading that work, and they're there to really help support county boards, intermediate care facilities, people in services, families, our providers, and really kind of pulling all of this together. And again, where your county board or your ICF is in the process may be very different. And so again, how you're going to experience that may be different, but we will definitely be here to support you if there's any questions or concerns. I'm going to put some resources in the chat for you. One is what we call an Ohio ISP spotlight video. Wanted to just share with you a link that really talks about the history and the why of Ohio ISP across the state of Ohio. That I'm hopeful, if it's Ohio ISP is new for you, that you could view it. If you aren't, but you're maybe working with people who are really trying to understand what Ohio ISP is. It's a video that you can use. It really talks about the history of our assessing and planning in Ohio, and again, talks about that why. So here in just a second, I'm going to put that in the chat for you. And Meredith, you can go to the next slide for me. And just in regards to resources and wanting to hear from you. So we have conducted and we have completed multiple different surveys so that we can understand how the implementation of Ohio ISP is going across the state. And so I'm going to put this link in the chat for you as well. So if you are someone where you have gone through the Ohio ISP process, we'd like to get feedback on how that's going for you. And so we have put some questions into an electronic survey called SurveyMonkey. If you have not gone through the development and finalized an Ohio ISP, so if you haven't gone through that process yet, these survey questions are really not going to apply because we're really wanting to see if you've gone through it, how has it gone? So I'm going to put this survey in there for you, and I'm hoping that you will complete the survey and give us your feedback. We want to understand, how is it going, and then areas that we need to continue to modify and change to make sure that we're supporting people and families in this process. So I'll put that in the chat. And then a last update, and you can go to the next slide, Meredith, is just, I'm going to share a couple links for you in the chat too around some additional resources around the Ohio ISP, resources that we've developed for people and families, as well as county boards and providers. So please check out the Ohio ISP website for any resources that you need. Please email us with any questions that you have. We do have a team inbox so that we've got multiple people monitoring it and supporting as questions come in. And then I'm going to be sharing our most recent Ohio ISP highlight video, which talks about both with an SSA and a parent and the person, how the Ohio ISP process went for them. And so I'm going to include that in the chat for you. And I'm going to look at the questions and see how I can answer some questions for you. And Meredith, thanks for having me.
Thank
So
you.
Jill asked, Jill asked a question about what kind of oversight is in place to assure that the Ohio ISP is being read and adhered to in ADS programs. And so Jill, that's a great question. To answer your question, we do have a compliance division that is in place at the Department of Developmental Disabilities that actually is responsible for both county board accreditation as well as provider reviews. And so when they are going both to county boards or they're going out to providers, a big part of that compliance process is looking at our rules and requirements, a lot around person-centered planning and the Ohio ISP to evaluate that the plan is being developed and that the individual's needs are being met and that those services are being delivered as identified in the plan. So it really is centered around right now person-centered planning. Since we're in the transition with Ohio ISP, we do have a rule that highlights the Ohio ISP and that county boards and ICFs will be using the Ohio ISP. So we're looking at right now the person-centered plan and the ISP, and that again by agency looks very different. After June 30th of 2024 is when we will begin specifically looking at the Ohio ISP, if that makes sense, because we're giving the entities time to transition to this, but everybody should have a plan now. And so in that compliance process is in place. So hopefully, Jill, that answers your question. And then if there is anything specific of any concerns that you are noticing that something is happening, I'm going to put in here, we do have related to the adult day support work, our community life engagement team, which is Keith, who you met earlier in the call. If there's something where you need some involvement for some training or technical assistance regarding service delivery, you can call in a representative from our team. So I'm just going to put that out there as well as, we can provide some assistance if there's any concerns, but we do have our compliance division. Great question. Any other questions for me?
I don't see any in the chat, but I also wanted to direct folks to our Ohio ISP website. There are some great resources there, lots of different scenarios and opportunities to learn about how to apply the Ohio ISP. Thank you, Stacy, for highlighting that video as well. I think it'll be very helpful for folks.
Absolutely. I'm going to get all these things added in the chat for you.
Thank you. Any other questions for Stacy before we move on? Okay, well, let's see. So Lori has a question or a comment. Those quality measures could really be used in this context as there aren't enough people to oversee providers.
Lori, thanks for that feedback. With the work that Keith was talking about in regards to quality measures for adult day support, that was a large chunk of the feedback we've received from stakeholders across the state is how do we really make sure that we're looking at the quality of services and what happens in adult day as well as what happens in employment services. So this ADS quality pilot that Keith talked about is connected to kind of this larger waiver work. And that is the intention is how do we start looking at the possibility of funding quality and what happens in adult day services as well as in employment. And so we're also working on the employment side as well, but adult day is the focus. So thank you so much for that feedback.
Thank you so much. So I am going to thank you for your time, Stacy, and for presenting on behalf of Beth. And as always, feel free to reach out to our teams with any questions. So next, I will be sharing a few updates from the Ohio Life Course Nexus and updates for families. So one way to stay connected with us in between our Family Advisory Council meetings is to join and subscribe our newsletters. This is at the bottom of our DoD website. There are some great resources and newsletters. Memo Monday is chock full of information. We have a family newsletter that's also full of resources and information. If there's things that you may want to share, feel free to reach out to me, and I'm happy to add that to those resources as well. And we also have a podcast hosted by my colleague, Nathan Turner. Nathan, I think, is on episode 3 or 4. And he does a great job. So Nathan, if you want to share anything about the podcast.
Yeah, I'd be happy to. Thanks, Meredith. So we have recorded at least 4 episodes, and there are more forthcoming. This next episode will focus on supporting people in direct care. I chat with Scott and Craig DeFassel of DSP Magnet, and it was a really exciting conversation, and I'm looking forward for you all to hear it.
Thank you, Nate. And then another exciting opportunity is Disability Connect, which is led again by Nathan Turner. And this is an opportunity for people living with disabilities who are served by our system to connect. So Nathan, if you want to share again on Disability Connect in the next meeting.
Yeah, I'd be happy to. The next meeting of Disability Connect is scheduled for Wednesday, October 25th at 1 p.m. We will be having a focus in addition to our regular question and answer with leadership. There will be a speaker, hopefully from the Department of Mental Health and Addiction Services. So we're really excited to have it.
Thank you, Nate. Is there anything else that you wanted to share about Disability Connect or any other projects that you're working on right now? Because I know you're a busy guy.
I am. No, I appreciate the opportunity. I think for Disability Connect specifically, while the meeting is open to the public, we really do intend for Disability Connect to be an environment for the people we support to engage with DoD leadership. And so their input and questions will likely take priority during the event, and we appreciate everyone's flexibility to help make Disability Connect a safe space for the people we support to speak up and make their voices heard.
Thank you so much. And do you have any highlights on the other project that you're working on, which is the disability specific newsletter? I know that you're working on that and getting some content for that.
Yes, Disability Connection will release its 4th issue on the 27th. We're really excited for that. It's going to focus on DSP support and awareness, and also focus on my participation with the upcoming Synergy Conference. I'm going to be facilitating 2 breakout sessions talking about the importance of diversity and the impact of racism. So I'm really excited to go to the Synergy Conference. It's one of the most important events of the year for the people that we support, and I enjoy going every year and connecting with everybody that attends, and I'm really excited to present the other R word in those breakout sessions.
Thank you. We do have a question in the chat for you, Nate. So do you have any plans to reach out to ADS providers to make Disability Connect available to more individuals being served?
That's actually a really helpful suggestion, and I appreciate the feedback. This is only our second meeting, and we're already tinkering with timing and schedules. So we will definitely keep that in mind as we look to make sure that leadership is able to attend the meetings. It's definitely something that we want to consider, and I appreciate that feedback.
Thank you, Nate. Lynn, do you have suggestions or thoughts around that?
Well, I know that things like We Thrive Together have been incorporated into some ADS programming.
Mhm.
And so it just seemed like maybe a natural extension that Disability Connect might be something that ADS providers would want to offer to their participants in order to tune in while they are there.
And yeah, that's definitely an interesting idea, and I do believe We Thrive Together is open to everyone, but I'm more than willing to explore what a direct collaboration with them would look like.
You're an intelligent young man. I like you.
Thank you, Lynn. I
I
think,
appreciate the confidence.
yeah, thank you so much. I think those are some great suggestions and opportunities for sure. So do we have any other questions for Nate or any other family updates? It's a good opportunity to ask some questions about other things that were shared that maybe you had a little bit of time to think about. We also wanted to share that we have a resource called the Family Resource Network of Ohio, frnoohio.org. We'll drop that in the chat. That's a great opportunity for folks to see events happening around the state. If you are a provider and you know of an opportunity or a presentation that your group is going to be hosting, there's a way to share your event on there as well. It's updated regularly, so it's a great place to see what's happening around the state, not just for other resources, but as well as other for families. Families can find resources on this page as well, not just events, but providers, and a lot of great information on there. Thank you, Corey, for dropping that into the chat. And, save the date. We will be having our Charting the Life course showcase. It will be next March. And details to come. There's some exciting things happening on that horizon as well. So do we have any other questions or anything else? Oh, I hear somebody unmuted. Did they have a question?
No, Meredith, I just might mention briefly, we are exploring how the experience of having a child or a loved one with developmental disabilities is a little different for fathers and for men. We do have a small work group of folks working together called Bringing Fathers Forward, and really looking at how the lived experience is for dads. We did some surveys and some focus groups with dads a couple of summers ago, and we really found that dads reported they felt really disconnected and isolated. They just didn't have relationships with people that understood what they were going through. They also felt like they weren't as informed with different programs, and they weren't able to really understand what was available or how to get some of the services and supports that they wanted. And then they also felt like they just weren't included in conversations that professionals were having, or even physicians or medical folks as well. So the Bringing Fathers Forward work group collaborated to develop a resource, one for dads to share some of the data, but also with professionals as well to encourage them to be more inclusive of fathers in conversations that they're having. So that is just some of the work that we're doing. We're going to be presenting some of this work at OcaliCon in the middle of November, and we're looking forward to that opportunity. So that is one of the other things we're focused on is how we're supporting families and looking at the all of an entire family is and how they're affected with a child with developmental disabilities, or a brother or a family member as well. So that's just some of the other work happening too.
Thank you, Corey. That's very important work, and I appreciate sharing about that work. Would you mind sharing the website, or the link to our website? There's some information on the DODD website regarding the work that you're doing with fathers.
Happy to.
Thank you so much. Thank you, Kristen, for the feedback. As always, families are always invited to come to this meeting. Providers, there's always opportunities to chat and talk to our leadership, ask questions, and feel free to reach out after this meeting as well. So typically we have an opportunity where the director joins us and she's here for questions. But if you guys want to drop questions in the chat, or feel free to email me or the Ohio Life Course Nexus, we can bring those questions forward to our director. I want to be mindful of everybody's time today. So with that, if there's no other questions, I want to thank all of our guests, all of the folks who have taken time out of their day to join us. And the resources and this recording will be uploaded to the DODD website.
Okay.
Thank you all so much.
Thank you. I just want to add, your questions are really important for the director. So sorry she's not able to make it, but please email those questions, include them in the chat. We want to make sure that we get them and we follow back up with you.
Okay.
Thank you so much, Stacy. And thank you to all of our leadership. Have a good afternoon.